So it looks like we have everyone on now as they come in. So welcome to another sports therapy lecture series. This one's a little bit different. It's more of a discussion between practitioners. So I think it'll be really cool and fun to listen to. We are joined today by Keira Forsyth, who is not only a physiotherapist, but she's also one of the clinic owners of Equus Physio. She does actually work out of our clinic working on humans, and we often refer horses to her as well. So that's kind of a cool, it's a little bit different than maybe you're used to when you go to your traditional physiotherapist in the middle of Calgary in a practice. You can find Keira at vet clinics working on people and horses, as well as her own practice, which is based out of Cochrane. And then, of course, we have Dr. Chad Hewlett with us today. He is the practice owner of Energy Equine and one of our veterinarians here. So today they are going to talk about how humans and rider balance and fitness affects the horse and vice versa. The topic of this presentation is called Help Yourself, Help Your Horse. So I'm going to let them take it from here. I'm going to swivel this way, and I'll be asking questions in the back as well. If you guys have questions, feel free to put them in the chat, and we will get to them at the end of the presentation. So thanks for joining us today on a beautiful Wednesday afternoon. Good day to talk about rider and horse fitness. You guys are gonna have to speak up, talk loud.
Thanks, Lisa. We can still do this just a little bit.
Where are we at here in time and space? There we go. Beautiful.
Thank you.
Okay, Keira, so we introduced you sort of. So give us the rundown of who you are and what you do.
Like you said, Keira Forsyth from Equus Physio. So Sandra Oxby and myself started the practice, we're coming up 3 and a bit years ago. And I would say the unique thing about us is that we are the only physio clinic in Canada that is specific to horse and rider. So not only do we also work on like horses for physio stuff, but equestrians are our main clientele. And Sandra and I are actually the only 2 physios in Canada that have our actual equine diploma in physio through the animal rehab division at the Canadian Physiotherapy Association.
Very cool.
So I would say that sets us apart a little bit different, even though we still do WCD, workplace injuries, and MBAs, and your normal twisted ankles, and your neck is sore from being stressed. But those riders are really our jam, and where I think we really shine. We're trying to change the paradigm of equestrian industry.
That's awesome. And Dr. Hewlett, you always like to tell a story. So what's your Keira story?
Oh man.
I didn't preface this, so Keira's not ready. But yeah, I always tell a story about like introductions or how we find people or how they find us, right? So I would say that it was maybe about 3 years ago when you guys kind of started on the scene a little bit. We had clients talking to us. Am I talking loud enough?
Louder?
Yeah, okay, I'll talk louder.
Always louder.
Sometimes I'm whispering when we get on camera. So 3 years ago, we had this, we see lots of people come and go in the industry, especially the paraprofessional industry, where they're coming and doing things. And someone started talking about this equine physio, like this physiotherapist. I'm like, who's that? Like I've been in the industry now 26 years, so we kind of knew what was going on. And then, so I just started asking some questions, and anyway, we just kind of found out about you guys through clients. And I like that. Our clients are very open, and I feel that they are progressive in the sense that they will move towards things that they feel like would help their horse, and maybe it's even new, and maybe we don't know what's going on. And so, yeah, that was kind of our intro. It was just like that happened. And then we had a dissection, and you guys came to the dissection.
Yeah.
And it was the story I really want to tell is about how fun it was to watch you guys with the ultrasound and needles.
Oh.
They, most people when they come to the dissection, they're a little timid or whatever, but Sandra and Keira had the ultrasound, the needles out, and you're doing all kinds of things because you do so much needling. So that was kind of unique that day.
That was actually really cool because, and maybe this is too much info for some people, but to be a human physio, you do have to do a cadaver lab. So we had been in those labs before, but super cool that with the needles and the ultrasound, that even though those horses were donated for science, that even though that horse was passed, you were still getting to see that reaction of that muscle and like going into that fascia. So for us, that was super cool. That was really interesting, and super interesting that you said when we first started coming onto the scene, because I remember like not particularly you, but other people being like, are these girls real? Like who are they? And I remember Sandra and I being like, yeah, that's why we chose red. We wanted to be strong and bold, and we're here to change. So, and that education piece too. So yeah, that's interesting that you say that.
Yeah.
So yeah.
Anyway, it's been a really cool evolution over the last 3 years with Keira and Sandra, as far as like just referring cases back and forth. And as we go along, I'd like to kind of look one particular, so I don't give any private information away. Definitely for us, it's been interesting because I've had clients approach us from the standpoint of wanting to work on their own positional stuff, and that's really what drove this whole talk. Was I wanted to visit with you quite a bit about that, how in dressage they work so much through the rider horse dynamic too, and in a lot of the other sports we know it's happening, but we don't, it's almost like we don't address it or we don't talk about it. And I mean, trainers do all the time with the non-pros, but I feel from a medicine standpoint, a lot of times I can tell what hurts a person or what they have in their life, in their body, based on what I see in the horse.
Yeah.
And I felt like you guys have a really dialed in approach to that, of how not only to I don't like the word fix, but mitigate the horse's problems, but also mitigate the humans' contribution to that with our own problems.
Yeah.
Do you want to
and
address
yeah,
that a little?
and to touch on that, we always say lots of times, I'm going to say different disciplines, but we throw a lot of money at our horse to get a massage, to get the Keira out, we're getting injections. So you're putting all of this money into your horse. But if we're one of the reasons that is causing your horse to have a sore back because we're not moving appropriately, what I almost feel like you're throwing away money. You're literally like throwing your entry fees onto the ground and stomping on it if we don't fix ourselves. So if we can put a little bit of money into ourselves, then inadvertently we're going to help our horse. And then we can put that money into, like, maybe you need to have more injections to get to that next spot. Or maybe, you're like, I couldn't afford the GastroGuard. So maybe that is going to go into that next step. Yeah. So we see that time and time again, and also say that you can't keep on fixing the symptoms when you go to the root of the problem. And we see all the time that quite often us as riders are that root of that problem.
Could you say that again?
Do I need to say it louder?
No, sorry.
We are the problem.
Yeah.
It is one of those things where we do see that a lot, where you'll go certain places, you'll see the repeated same thing in different training horses. And I think that's, and just horses in general. If a client owns a horse, we treat the same thing over and over again, and you always wonder about that. I hear lots of clients say the same thing. They're like, oh, I wish I treated myself as nice as I treat my horse. I do everything for my horse. And we encourage them to start doing things for themselves, right?
So I have two examples of that. So Sandra and I used to do riding clinics where, so the overall, whatever formula of the day is, we watch you ride, pick apart a horse, pick apart the human independently, work on them independently, and then put them back together. So we obviously haven't done clinics in the last little bit just due to everything going on. However, the last clinic we did together, there was 10 pairs. 9 out of the 10 pairs, the horse and the human, had the exact same thing. So we went into that day saying, you take all the horses, I'll take all the humans. You work, we'll look at them together. Don't tell me what you're going to work on. And then at the end, when we put them back together, I said, I worked on the horses, C3, C4, and Sandra would be like, I worked on the humans, C3, C4. The SI on the right-hand side. And that went for 9 out of the 10 pairs. The 10th pair that wasn't the same, the horse was presenting as somewhat neurologic. So, and the human didn't have those signs and symptoms. So obviously we're not expecting that to be the same. But we see that time and time again, that when we go out, look at them together, they usually have the same thing going on. And then my second example would be, let's say you're a trainer, let's say a barrel racer, and you're running all your horses to the right, but maybe you have some left horses in there and some right hand horses, and we kind of usually say that. But what way the mane normally falls. So in our view, those horses should be ran the same way. Or what are you always having trouble with your first barrel, or always having trouble with your second and your third barrel? If those are some symptoms that are coming up, we're usually saying it's a problem with you, the rider. And when we take a look at them running, be like, yeah, your right hip isn't moving properly. That's why your horse is actually falling in at the shoulder. You're not holding up that rib cage. And then if we work on them, boom, that first or that second or third gets instantly better. And we see that time and time again.
Amazing.
Don't look at too many of my girl horses. I won't eat very well.
You won't eat very well?
You fix all the riders and then you can't come in when they're broken. You'll get in trouble. So it is kind of interesting though. So you're trained, like for you as a rider, what was your main focus as like, did you come up through Pony Club? Did you come up through 4-H? Like in a training barn? How did you start?
No, I would say I grew up with a love of horses from a very, very, very young age. I didn't get one until I think I was in grade 5. And then I went the 4-H route. Growing up in BC, that was the route. Started off in Western Pleasure. And then I chased cans for a little while. Then my good horse broke her leg. And then I had a couple young ones that I just trained, sold, went through university. Then I went into Jumperland. And then I've kind of done open shows, like flat stuff, English and Western and trail. And then now I'm back to having a bunch of young horses. So I would say I'm not specifically discipline specific, but I have tools from a bunch of different disciplines. And yeah, I would say I'm decent at everything, but not good at any one thing or throwing all my entry fee money into one of them. So.
And would you say that it was just your education through the physiotherapy field that brought you into like the mixture of things, or did you realize at an early age that you were contributing to what was happening with your horse? So those are questions. I know it's a weird question to ask, but I would say, like, I would openly admit that for the first 15 years as a veterinarian, I could see that the humans were involved, but I was, I almost denied it. Does that make sense? Like, I was like, wow, they're doing this, but this is this. And then about 15 years into it, I was like, we just got to talk about this and see what we can do, right? In some way.
No, I didn't know it previously. Yeah. And in all honesty, I didn't know equine physio and rider physiotherapy was a thing until physio school. And I would attribute that to Sandra. But I would say the correlation came, I remember sitting in one class and we were working on someone's like shooting skills for hockey, and they had like an ankle sprain, and then working on different exercises for that, just as it was just an example in class. And I don't think it was until back there being like, well, why are we working on their shooting if it's their ankle sprain, but really they're having to weight shift off of that to affect their whole game. So I don't think it was until that moment that I realized that me as a rider, I could be at a detriment to my horse based on my physical asymmetries. And then, and in all honesty, they don't teach you about any of this in physio school. It's not until the animal rehab division, so until you're afterwards. And that specifically is more specifically horse related. So I would say Sandra and I have come up with a lot of those dysfunctions that come up all the time, right? Like the patterns that we see. So hasn't really been until Equus that we've truly been able to like dive in. And I think this is truly just like that little bit of that iceberg at the top, and there's all this underneath that's going to come out hopefully in the next 10 years while I'm still in practice. Does that answer that question?
Yeah. And then, so with Sandra, I know Sandra comes from a strong dressage background.
Yeah, very.
From,
and reining.
Yeah, and reining. So yeah. We would call reining Western dressage, so to speak, before this newer
Western dressage.
Newer Western dressage came along, and when I was first started, we'd say, reining, it's kind of the dressage of cowboys, right?
Yeah.
So did you guys kind of see it at the same time? I guess what I'm trying to get at is like the only sport that really hammers on it, like that I've noticed, is dressage over and over again. When I go to Crystal's, it's just like, you're doing this and you're doing that. That's why the horse is doing this, right? She's just so, I don't have a better term, but mechanical in the sense of like, you're causing that. The horse is doing this, but you need to do this. And so
I think we're a big paradigm shift, right? Like, I think we're like this light switch that not everybody has that light switch turned on yet. So when we first started out, we truly thought dressage riders were going to be our main clientele. Yeah. And they definitely were at the beginning. Jumpers are in there kind of just as much, but in all honesty, in the last year and a half, plug your ears, but barrel racers have truly got in on it. And I think it's because that small little thing is going to make a huge difference in your run, right? And I'm unsure whether or not all the other disciplines even know we exist yet. Like I truly don't think we're fully into that reining world. I don't think we're into that cutting world yet, or the cow horse. We do have quite a few rodeo contestants in general. Like I'm actually really surprised at how many like steer wrestlers we have and ropers and shoulder injuries, or being able to get out of your saddle to go forward right out of that box. So yes, I think dressage was probably keyed in on that a little bit quicker, but they're definitely not our number one that we're seeing in the clinic, or the ones like, hey, we need you out now. So that's definitely changed. But I think as we go along, that's going to be more encompassing of everybody as we go out. And I also don't want to forget, even if you're not competing, you're still having an effect. So if you like, your back is sore and you're wanting to go for an 8-hour trail ride on your horse up to Kananaskis this weekend, like your poor horse's back is going to be sore by the end of the weekend. So I don't want to just think this is just for people who are competing, but for anyone who's truly getting on. Like your back's not moving, you're not going to be able to sit in that saddle appropriately and move with them. Poor whatever, Frank is going to be getting this on his back for the weekend. Frank is the horse.
So I say, I love where you guys are at with this. I would say, no matter the training barn that we go to, like if I go to Dustin and Marla's, an open cutting horse trainer, when I watch Dustin get on a horse and he's immediately on it, or Greg Garvey or Cody, or it doesn't matter, any of those open trainers, one of the things I noticed right away is they're just trying to engage that horse's back and get contact instantly, right? Like they're just like they're looking for that posture to come, almost like that's the first thing. It's like get on them, make sure they're not going to buck them off or whatever if they're a young horse. But then it's just immediately you just notice, like when I watch Code, when I go to his place to work on horses, it's just like everything just kind of rounds up right away, right? And my dressage riders, same thing, especially with the open caliber. It's like they're looking to get that posture correct, and I see them come into a real good posture as well. So I know it's there at the open level, and I feel like do you do some of those open riders too, like, you know what I mean, in the sense of that, or is it mostly I got one horse and this is my hobby, or how does that work?
I would say there's an equal mix of those people who are competing and the people who are not. I would say it's totally an open mix. And I'd also say that sometimes, you know, you might have a lady, like we've had tons of ladies, honestly, in their 60s or in their 70s, that are putting just as much work into themselves because they want their 20-year-old horse who they've had for the last 15 years to be able to ride another 10, right? So, and I feel this in physio that, you know, kind of in like, you start to feel stuff in your 30s, and then 40s, you really start to feel stuff. Like you have a workout and you feel like, well, I really can't walk in the morning. But I truly feel when we get a little bit older, we put a little bit more time and energy into ourselves because we know it's going to make a little bit bigger of a difference, and they know that more, right? So that's where I think those open people are just as important, and they're putting just as much into their that answer that.
I was gonna say Wheezy's
So Keira, tell us a bit about Equus Physio, because it's not just physiotherapists. There's a lot going on over there in Cochrane. So what else is the?
Yeah, we have a great team right now. So based out of Cochrane, there's actually 4 of us physios now. So there's Sandra and myself. So for me as a physiotherapist, I do regular physio. So you can come to me for anything: sprain that ankle, sprain that wrist. Car accidents, WCB, you get hurt on the job, you can come to us. My other passion that I think hugely correlates with horses and riders and postpartum is pelvic floor and women's health. So that, and then of course do the horse side of things as well. Sandra, again, you can come to her for any of that stuff. She also does canine physio as well. And she also works at CFC, which is a dog physio clinic in Calgary that is specific just to those canines. And that can be your little pet next to you there, or that can be like your super dog that is like competing at a very, very high level. And then we have Erin, who is also a physiotherapist plus. She's a rider. She's into the jumpers big time. And then we have another girl named Caitlin, and her specialty is simply just the pelvic floor stuff. So we have a very wide range there. We also have kinesiologists that work for us. So if there's an exercise program that maybe we can't put as much time and energy into, then we can send our clients to her. We have we have 3 registered massage therapists. We have an osteopath. And then we also have our front team. And then of course we have Teresa, who does all of our, I don't just call her an equine massage therapist, but she's our rehab person. She's much more than just massaging horses, but we see a horse quite often. We will create the program and then have her kind of complete that for us. So that's a bit about our team. And we have, in all honesty, I would say we have exceeded our expectations of where we thought Equus would just be a side hustle. And yeah, it has grown exponentially. And we are currently, if anyone's watching, we are looking for a physiotherapist, a kinesiologist, and another RMT if anybody knows of anybody and wants to join our amazing team.
Holy moly, they're hiring.
We are hiring. Oh, and I forgot our client director, Shelby.
Oh, right.
Yes.
Go ahead.
Nope, that was it.
And so I know it's I know it's individualized to the rider, but let's say your average rider, like I know you use quite a bit of modalities when it comes to your physio treatment. So like, what can someone expect if they have a sore back and they're riding Fred down the trail and Frank, whatever, and they come to Equus Physio?
So if they're a rider and they're coming to us for that, so we will do our regular subjective. We will ask you all the questions of what's going on, where are you feeling it, all of that. Then we'll run you through range of motion, which is active, just getting you to do movements, seeing where you're limited, where your asymmetries are. If we think there's a muscle imbalance, we'll muscle test you doing certain movements. If you are a rider, we do like you to get in the saddle when you're in the clinic. So we have a jump saddle, dressage, and a Western saddle in there. So be a little bit discipline specific. So get you on, see where your asymmetries are sitting on who we call Steady Eddie, which is just really our saddle stand, because as soon as you sit on him and if you're asymmetrical, we'll see it right there in the saddle, and we have a mirror there looking. And then depending on what you need, so this is all very whatever, we use our hands. So I would say we're all manual therapists, use our hands quite a bit. We do dry needling in the clinic, so biomechanical dry needling. So going in either the muscle, trying to loosen that, or if we think it's not activating, maybe trying to get at the actual nerve, so closer to the spine. We do cupping, so fascial release. We do soft tissue massage. We have ultrasound. We have lasers. We have shockwave. What else do we have? We do K-taping, kinesiotaping taping in. And then, of course, I think the most important part is your rehab program afterwards, because you can come to us, lots of times. If you're not carrying the stuff outside of the clinic, you're 99% of the time, you're not going to make that change for Frank on the trail. So we give you exercise hoping that you're going to continue on with that outside. And then, so if you are a rider, we do suggest you come into the clinic first so we can kind of get the broad spectrum. And then it's really great to have us come out and watch you ride. So pick you apart, see where is Frank a little bit sore, or if we think that there's something where we need to get you out in on it, being like, I think there's a little bit more going on with Frank than just sore back, because maybe Frank's blocks were sore, which then led to that SI, then led to the back. We're not going to just fix that. So we need to help fix this person, plus then get the vet out as well. So, and just to kind of shift that a little bit, I think that's where, if you came to me for a sprained ankle, I'm going to ask where you got your x-ray or ultrasound done. Who else is working on you? What are your doctor's reports? And I'm going to ask for that. So, get you to sign a consent to release and get those records and have that communication with the rest of your team. And I truly think that's where this relationship is so good, is that we need to change that in the horse world, that everybody is communicating back and forth. Because I'm going to steal this from Danny from DK, but if that wheel of influence, that wheel of one of your spokes is not super strong, that wheel is going to collapse. So yeah, you're working on yourself, but if you don't get Frank worked on in other parts, that wheel's still going to collapse. You're not going to have that sound horse going down. So I think that's where we really want to be, that shift in that equine world, is that everybody works together, and it's it's not a competition, right? Like there's enough work to go around. Everyone kind of has their lane, and or maybe not even their lane, but their paradigm, their lens to look at things, and look at things a little bit different. So the stronger your team can be around there, and that communication, because any sort of relationship that we're talking about where communication is key, that's your key point. Your team with horse and rider is going to be stronger. So that's where we like to have that. And let's say you wanted us to come out and look at a horse. We always try and get those vet records, be like, what is actually going on? Where do we think we should focus, or where do you think we should focus our treatments and stuff on too?
Mm-hmm.
And then also just like Equus has gotten so busy in the last little bit that truly we, in general, unless it's a special case, we don't generally go out just to look at a horse, because we want to see that relationship between the two. And we think that's where we really excel as your spoke on that wheel, right?
That's awesome.
Sorry, I really took that for a shift.
No, it's good.
Down to the dirt road, Frank.
Chad, do you want to touch on that and like the team approach that Keira is talking about?
Yeah, it's been a large part of our practice for the last few years. Is like, how do we integrate all the pieces and try to have a really strong wheel? I like what Danny says about that. I remember the first time we
gotta talk.
Both talking about it. So I just really like the team approach and being able to make sure those spokes are all strong. And I do agree with you 100%. I think it's supporting each other inside those roles. Like I know very specifically what my role is, and that's to mitigate pain at a particular level, right? And inside those programs, we've said many times over, our clients that are participating in some sort of other modalities, it could be chiropractics, could be osteopathic, could be physio, could be massage, and oftentimes it's a combination of those. I feel like if we were all working in the sense of that we each have our part, and that my part's this part, we got this part, and the parts aren't any bigger. I think that's the one thing. It's just trying to come to that and being able to put those all together and have that central focus, along with the horseshoe and different things. So.
And on that, I think this is like the human medical world as well, is that if everyone was just like super nice with their knowledge, do you know what I mean? To share that knowledge around. So one of your team members, Travis, I think he's really nice with his knowledge when he comes out. Like he's not afraid to verbal diarrhea everything that is going on. And if the medical language is up here, if he brings it down here for everybody, that I just think that is so, like, one, just such a powerful key, but that everybody, even the rider, is going to benefit from all of that. If we're all just really nice with our knowledge of what we know and what our lens is, again, that team, that literally that horse and rider is going to be so much stronger, I think. Yeah.
So you talked about modalities for riders, but I know especially like it seems like equine physio in the States too for rehabilitation is really on the up and up. And I know there's some modalities that you utilize on horses. So what would that look like?
In all honesty, we do all of the same modalities on humans and horses.
Cool. So
anything that you have had done by like yourself as a human, the horse, we do that exact same thing on the horse. So the shockwave, the laser, the ultrasound, the TENS machines, and we have wireless ones. Oh, I lied. The only one we don't have is intraparental current IFC, because that one has cords and it's huge and we just don't bring it to the barn. But we have the TENS machine instead, so that would just be like a pain modality. But everything from our muscle stem, like let's say Chad blew out his ACL, so a part in his knee, and his VMO, which is one of his quad muscles, wasn't firing well. And we had to put on this electrical stim to get that knee to extend, which would be straighten. That stim, which you want to do with exercise, but the research shows that if you do not just get that muscle to contract, but contract with an exercise, so on purpose, we can do that with horses. But you're going to get better faster. So even that stim, so even doing a tail pull while you're on a balance pad and having stim on, that horse is going to be able to get that nerve connection to that muscle a lot better than just the tail pull in and of itself.
Very
Sorry,
cool.
I'm a really big nerd and I start talking about
I love it. You said ultrasound, and for those,
sorry.
Yeah, and I wanted,
so So not diagnostic ultrasound. So when I talk about ultrasound, it's not the baby one that I'm going to see your stomach, because sometimes I have a man on the table and he's like, you're going to do ultrasound on me? I'm like, no, it's therapeutic ultrasound. So while it's using the same waves, same technology, it is a therapeutic ultrasound to try and get those tissues, to heal better, break up scar tissue, increase blood flow, not diagnostically, which you guys do, which is in your specialty, your realm. I could look at something and I couldn't tell you if I was seeing an ovary or if I was seeing a rectum. So
So Chad, what is your experience with some of the modalities for horses that Keira's talked about, and physiotherapists in general, when it comes to the horse side of things?
Yeah, I feel like there's you have your central nervous system and you have your pain body response, like the cycle, right? Like, and I feel like there's a lot of different ways to I say break or ease or appease or whatever, and I feel like we're all in the same spot. We're trying to find that root, and how do we turn that off permanently? In some situations you can't, so you're looking to use whatever you can to help that horse if it's had some sort of injury that's repetitive and it's got a pain, that neuromuscular pattern's the same. And I think that's a big part of where you guys really help us is in being able to get at that and try and break that down and working off of, so if, let's just use an example, if I have a set of hocks that are arthritic, well, we still have hamstrings and we have other things going on, through the back that need to be worked on as well. And I think that's a strength there if we can put those together, right? And sometimes we do some shockwave on backs, based on different things with pathology there. It's all about trying to, like we said, just get that reset or whatever. I feel like that's a big part of what you guys are doing as well.
Yeah. An example, so a similar example, I would think maybe you could, like, let's say the stifle, A was weak, but B is painful. So in just another example, come in, you could do an injection in that stifle, stop that pain cycle, because if that pain cycle, that horse is not going to want to flex, like not going to want to engage that, right? So have that injection, that pain cycle comes down, and then that's where that next part of being like, okay, we need to actually activate these muscles, A, through modalities, or B, setting up a rehab program where you're doing that at home, so that when that injection wears off, and this goes same with humans, when that cortisone injection wears off, that area is stronger, more stable, so that there isn't that cyclical cycle. So just like another example there. Yeah. But you also mentioned, like, you're doing the shockwave on the low back, so hocks, then the hamstrings come, and then the low back. So we see this time and time again, and I'm going to get onto the floor. I usually get onto the floor or some sort of
okay.
So
we're getting onto the floor
first. But, so hamstrings, obviously they attach right below that knee. They come up right below that gluteal fold, which is your bum cheek. Okay. If these are quite tight, they're going to put me more into an extended position where I'm arching my back. So if I arch my back here, my low back right now does not feel great. So this is a common thing in humans, is that we're going to get those tight hip flexors, tight hamstrings, and then my back's going to be painful. So now if I get onto all fours, you're okay, we're good.
We're good.
So if I'm a horse, okay, I'm on all fours, I got tight hamstrings, that's going to put me a little bit into that arch. I got, now my horse was 8 years old and now it's looking like it's 80, right? And where am I going to get this low back pain, okay? Even think of our spinous processes here. We're having all of this stuff come up about kissing spine, but if, let's just think of where our muscle attachments are, insertions, that if we just lengthen those hamstrings out, got a little bit stronger in the front and stronger also being length, so that muscle not being tight and weak, then our back could be a little bit better. And honestly, that's a super common one that I'll watch someone walk, and I'll be like, if you're riding, I know your horse's back is going to be sore on that right hand side because that hamstring's so tight, because you're always sitting cross-legged and then you're getting on your horse, and so that cyclical cycle. Side note.
Thank you, Keira. Thanks for getting on the floor.
Quite often I get into the arena and try to demonstrate something.
Oh, yeah, it's good. It's a good visual. Chad, do you have anything to add to that?
Yeah, we won't dive too deep into the kissing spine because it's such a big potpourri of interesting dilemmas from a sales standpoint, a riding standpoint. So one thing I do wonder about, this came up when you were talking about it, and I've thought about it, and I've discussed it with some of my trainers, especially some of those speed trainers, is do you think some of the dorsal spinous process disease that we see, do you think that has to do with like horses that are willing to exert themselves at 100% to run out of barrel or do something, and in that extreme flexion or extreme extension of the body, they touch? But this is where I come back to, because we see this happen where you'll have horses that radiographically they have changes, right? But they have no clinical signs, okay? None, zero, especially with a very qualified riding individual, right? And they'll be perfect. And we're not treating a back problem. We treat some, some things underneath or maybe whatever, but it's pretty standard, like joints that don't move, right? Hocks and pasterns and coffin joints, right? Those are very common joints for us to treat. And I don't think it's because people are being mean to their horses. Those joints don't move. And so they have to take the full concussion so they break down quicker. That's my opinion. I'm not saying I'm right, but that's what I believe. But we get into some of these back things where I think they develop looks like kissing spine, but it's because they're such a good athlete at what they do. I wonder if all four of those legs, as they come out, if that back doesn't get so stretched through the run, that if you do that over and over again, you are going to see some changes. But as soon as they come back into doing their normal thing, that rider saw them coupled up, the horse is doing what they're doing, they show no signs and they have strong backs. This is just
I don't think you're wrong.
Yeah.
I 100%, I don't think you're wrong. And I also think you're like, we're not treating that, there's no symptoms there. So if the horse radiographs that, let's say it radiographs and it's bad, but if there's no symptoms, then why are we treating something that doesn't have some? It happens in humans all the time. And I can't remember what the actual word for it is, but the normal example is there's been studies and you have two identical twins. One has such bad back pain, really, really, really bad back pain. The other one has none. They both go in, get an x-ray. This one that comes up that has the bad back pain, his radiographs are like almost clean. This one, no back pain, his radiographs are really, really, really bad. And lots of times I have humans come into the clinic and they're like, oh, but I got like degenerative disc disease. They're 70, degenerative disc disease, or I have a little stenosis, which means the narrowing of where your nerves come out, or I have a disc bulge or a herniated. I'm like, you have no symptoms of it, so let's just pretend that didn't even happen, because there's no point in focusing on that if there isn't that pain cycle to it. Yes, we may need to strengthen, like you said. So as soon as you radiograph that and you can see those dorsal processes coming together, but if they're in a good position, their core is strong, just like humans being core strong. And I'm not meaning just your abdominals, your six pack that in my mind truly don't do anything other than look good. It's your multifidi, it's your paraspinals, it's your transverse abdominis. So if that's holding us all there and being strong, that's going to be more important than what that x-ray, I think, said in a very broad sense.
Okay.
Yeah.
Just so you know, I'm going to use that a lot. Just so you know.
Okay. I didn't know where that look was going.
Yeah, I'm going to use that a lot. We're struggling in the industry right now with this because it becomes a dumping ground for problems with the horse sort of thing. And I'm not trying to pick on her or whatever. We're going to have to work our way through this. We now have all these available imaging modalities, right? Meaning, you go back 25 years ago, and my techs would laugh because they hear this talk over and over again. I used to radiograph about 10% of the horses for a pre-purchase exam.
Yeah.
Now it's the other way around. We radiograph 90% because it's so available, so quick. And it's just, we like to know. Yeah. And I think we started x-raying backs a lot about 5 or 6 years ago. And now all of a sudden we're trying to figure out how to handle this, because there are some that do have radiographic changes that are completely normal in their function.
Yeah.
Like completely
maybe
normal.
Instead of the saying of don't ride the papers, it'll be like don't ride the x-rays. Something along those lines.
Well, you do. There is actually a video on the internet of a jumper in in Europe, I don't remember who was telling me about this. The video is called You Can't Ride the X-Rays, because this horse failed a pre-purchase exam as like a 2-year-old.
Yeah.
And went on to be an international Grand Prix jumper that was worth $500,000 or $750,000 gelding. Right?
Yeah. I guess
And
McDavid would be a prime example.
Yeah.
Right? Like his knee, if you did imaging on it, like those ligaments internally probably don't look 100% or initially didn't. And if you would have taken him as a horse, right? Image that being like, I don't know if he's going to return back to sport or be your Grand Prix anymore. I'm looking at him now, right? That's just my one hockey player that I know.
Yeah. So, okay. Anyway, that was my one comment on that.
Yeah.
So Keira, how do you're here at our practice today. So how do you work within our practice?
I come and have fun all day. Yeah, so I get to come to Energy Equine, I would say, every 3 weeks, probably 3 weeks. And then from what I hear, I don't know because I don't make the schedule, but I feel like not everybody gets to make the list.
True. The list, I got skipped 2 times now.
So really, I get to come in and I work on the team here at Energy, and not just the veterinarians, but also your support staff. So your techs as well, and your front desk staff, and making sure that everybody is as optimal as they can be, right? Like if you have a vet that just did a bunch of teeth, their shoulder, obviously shoulder neck might not be feeling as good. And when you go out the next day and you got to do a bunch of rectal exams, think about how that shoulder is going to be sore. So if we can keep the whole team functioning a little bit better and stronger, I would say they're going to be stronger and better suitable and mobile and pain-free for when they come out to your horse and to treat you guys there.
Mm-hmm.
So, and that's honestly, that same goes with your front girls, your client care specialists that are down there right now, both of them ride and compete, right? And they're sitting in the chairs all day long. And even though I've told them that they should be wearing headsets, so I'm not putting that phone here so their neck doesn't hurt. But even them, when they get back onto the one is competing this weekend, but working on her today, being like, hey, your back is sore, your upper traps are sore, let's loosen that up so that when you get on your horse on Saturday, you're not super stiff as a board from sitting there, probably not sit up as much as she should, and that she is mobilizing a little bit better too. Yeah, that would be my Cole's notes on that one.
Anything to add to that, Chad?
We just really appreciate that you come and do this. It's a big part of, I think it's really helped us move forward as a team. I know it has, like in the sense of, if you just feel better physiologically, whether that's your muscles or your bones or whatever, I think it just radiates through how you treat your people, or how you treat people that come in as customers, as well as interaction amongst your group.
Yeah. And I actually was going to say that if the front team is feeling better, they're probably going to be happier on the phone to you, and you're going to be able to do all of that, right? Because physical pain does play into our daily lives and what we are like personally and what our attitude is. And because, pain can be that really negative cyclical cycle. Yeah. So thank you. I enjoy coming out.
Well, we enjoy having you.
Yeah. And I get to talk horses all day.
Yeah, exactly. Sneak in some of your own personal questions to the vets about your own horses.
Exactly.
Get some free advice.
Exactly. And I think one last little tidbit, just some common things that maybe you as riders can think about is common things that we see in the rider that would negatively affect that horse would be having tight hip flexors. So if I'm sitting all day long here, so my hip flexor being in that front, that if this is tight, I'm going to be a little bit more forward on that horse, meaning I'm going to be a little bit more forward. My horse is going to be more on their forehand. My pecs are going to be a little bit tighter. I might be a little bit heavier into that rein, right? Our hamstrings being a little bit tight from being sitting. So that affecting our low back, not being able to mobilize forward and back, horse not being able to move with that. And I always say, everyone should be able to pelvic tilt. So my little saying is you should pee low down on a tree, pee high on a tree, pee low on a tree, pee high on a tree. Because that's truly what we're doing when we're riding, is that we're going forward to back without our shoulders moving. And if we can't do this on old Frank, then we're going to be doing this in old Frank, and then everything else is going to be moving too. So, and even knee injuries or ankle injuries, if we're not weight bearing the same through those stirrups or irons, then think about, if we don't have equal weight or we're a little bit more weight on one stirrup versus the other, then we're going to have different weight distribution on the back in that saddle. And then that's going to show up in our horse as well. And maybe, or hip not moving properly, or SI being able to pick up a lead, yada, yada, yada. So just wanted to throw that out there. Those some common things that you can look at for you as a human and how it may be affecting old Frank or young Frank.
Or mid-aged Frank.
Or mid-aged Frank.
Awesome. Well, if there is any questions, feel free to put them in the chat box. I don't see any right now coming in. I'm just we're gonna just move this around. You guys get to see my face. If you have any questions, feel free to drop them in the chat box. We did cover quite a bit though. Doesn't look like anyone has anything to add. So I think we're already at like 45 minutes. It's really, I know.
That's why I did the last little bit. I thought we could talk more.
I know. I was like, this really did. Yeah, we're like almost at 50 minutes. So we will cut it short, but because there's a wealth of knowledge. But again, I think like my big takeaway after utilizing you and as an equestrian is it's so individualized. So basically, I think as a rider, get into Equus Physio. How can they get in touch with you?
So you can go to our website, www.equusphysio.com. You can email us that same at gmail.com. You can also give us a call. We have the old school telephones, 587-493-0444. I don't know if you wanted all that info, but anyways, or we're also on Instagram under Equus Physio, or if you want to follow me for all of the pelvic floor stuff and women's health. My name is Lady Biz Fizz. That's for Equus, PHYZ. And then, we're also on Facebook as well. So,
and then you guys do virtual assessments as well, 100%. Don't you? So what does that look like for someone that can't make it to Cochrane?
Yeah, so virtual assessment, same exact thing. So we usually like to see you face-to-face on the screen first, discuss what's going on. And it's on our software, like our actual charting software. So it's all safe. That is a Jane, which is a Canadian company actually, which is quite cool. So it's like a Zoom, but a safe Zoom. And then we ask you all the questions. We get you to do the movements. And then really it's more of a exercise-based thing, one-on-one there. And then if you do live like a ways away, you can always send us videos of you riding. Or even better yet, the next one you come, and I've done them where I'm watching you ride on that screen and I'm literally telling you what to do or where I can see your asymmetries while you're riding. So obviously you need to have another person there with you, whether or not a parent or your trainer or anything like that. But yeah, we've definitely treated people all over Canada, down in Australia. We have people over in Europe. So it's pretty cool.
Awesome.
It's really cool.
That is very cool.
Yeah.
Awesome. Chad, do you have anything to add to this conversation?
No, just brilliant. Yeah, thanks for doing this.
Yeah,
we talked
welcome.
about it.
Thank you.
We talked about it like 6 or 8 months ago.
Yeah.
Just couldn't quite get it to all come together. And then I think last time I saw you, Louisa missed 2 times. I think I missed 3 times with you being here.
Oh, poor Chad.
3 or 4 times ago, I said to Keira, I was like, let's do a talk because I would really like to integrate in how we utilize you in our practice as well as how we utilize your physiotherapy in our business too.
Yeah.
So thank you.
Yeah, thank you very much. This was great.
Awesome. Thanks for joining us, Keira. Bye. Now back to me. Thanks for joining, guys. This will be uploaded onto YouTube next week. If you guys want to watch it back or send it to any of your friends that couldn't make it. Thanks again.